Hello everyone, my name is Jaylene Sims with the Love Your Life Foundation. Thanks for tuning in. Today I'd like to discuss a few quick tips about breast health. First, I'll start off with the facts. 1 in 8 women will be diagnosed with breast cancer in her lifetime. Breast cancer is the leading cause of cancer among women, and it's the second leading cause of cancer death among women, only behind lung cancer. 220,000 women will be diagnosed with cancer every single year. And I know it seems very rare, but 2,150 men will be diagnosed with breast cancer every year, and 410 of those men will die. Now let's discuss a few risk factors. Number 1, being a woman. Women are 100 times more likely to develop breast cancer than men. Number 2, growing wiser or older. 2/3 of the women who are developing breast cancer are greater than the age of 55. Number 3, your race. Breast cancer is most commonly diagnosed among Caucasian women, although African American women are diagnosed with the most aggressive cancers. Number 4, your personal history of breast cancer. If you were affected in one breast, you have a greater risk for developing breast cancer in the other breast. Number 5, your family history. If there's a family history of breast cancer in your mother, your sister, your daughter, or a father, you're at a greater risk for developing breast cancer. Along with the family history is the BRCA gene, or the BRCA gene. If you have that gene, you are at a greater risk for developing breast cancer and ovarian cancer. And number 7, having a greater history of estrogen exposure. Let me explain that. Early menstrual periods, starting before the age of 12, or late menopause, after the age of 55, or having a late childbirth, or having no children at all increase your amount of estrogen exposure. Now that we've discussed some of the risks and the facts surrounding breast cancer, let's discuss early detection. Mammograms. Now, you may be aware that there are different organizations that recommend different things. For instance, the U.S. Preventative Service Task Force recommends that you start at the age of 50 and you go every other year. However, the American Cancer Society, as well as the American Congress of Obstetrics and Gynecology, they recommend that you start at the age of 40 and you go every year. Here are a couple resources that are available to you if you do not have health insurance. You may have heard of the Susan G. Komen Foundation. You can call them at 877-GO-KOMEN. There's another organization called the National Breast and Cervical Cancer Control Program. You can also contact them. And then one that I just learned about is the YMCA. But those are all resources that you can try if you do not have health insurance and you would like to get a mammogram. Next up, let's discuss the clinical breast exams. You'll have that done by your healthcare provider in the ages of 20s and your 30s every 1 to 3 years. Once you turn 40, you'll have those every single year. You may start to notice that when you go for your well woman exams, even if you're in your 20s and 30s, they'll go ahead and do a breast exam just so they won't forget when the last time you've had it done. And that's A-OK. Lastly, the self-breast exams. Now, those aren't recommended anymore. However, there's a new concept of the self-breast awareness. We do recommend that. What that means is you just become aware of how your breasts feel and look throughout the month, and then if you start to notice something that's different, that's when you contact your healthcare provider. Here are just a few notes to be aware of. The first one is, if you're younger, you may start to notice that you have lumpy breasts, and that is A-OK. Number 2, around your menstrual cycle, sometimes you have more estrogen in your body, therefore your breasts will feel a little bit larger and a little bit more lumpy. So it's good to know how your breasts feel throughout the entire month, and that's when you start to notice differences. You go and talk to your healthcare provider. Next up, I'd like to share a few signs that you would definitely need to report to your physician. The first thing is nipple discharge. Any kind of nipple discharge when you are not pregnant or breastfeeding is a problem, and you should report that to your physician. Next, you want to report lumps that aren't going away or lumps that are getting larger. Lastly, you want to report nipple redness or breast redness and dimpling. Last, I'll share a few tips to reduce your risk for breast cancer. Number 1, try to keep a healthy weight by increasing your fruit and vegetable intakes and exercising regularly. Number 2, try to limit your alcohol intake. Number 3, reduce your exposure to radiation and other cancer-causing chemicals. If you'd like to have more information about breast cancer, please visit your local healthcare provider. You can also take a look at my video presentation called Tata Talk. You can go online to the CDC website or Mayo Clinic, or you can email me on my Facebook page or jaysloveyourlife@yahoo.com. Thanks for tuning in. We'll see you next time.